Well, hello, everyone, and welcome to our fifth meeting here of the Senate Bill 460 work group. For those of you who haven't met me yet or were not able to attend the last meeting, my name is Andrew Tress, and I'm the very new Director of Government Relations here at MIA. So it's kind of slowly but surely taking over some of the responsibilities for this work group from Mr. Boone, who's obviously already also on this call. I'd like to introduce the members from MIA that are present. We have our Principal Counsel, Van Dorsey, our Associate Commissioner of Life and Health, David Cooney, Associate Commissioner Mary Quay, who else members, Director of Communications, Craig I, Jamie Sexton, who's also part of our government relations team, and Associate Commissioner Joy Hatchett. I think I have everybody here from MIA. If I missed you, let me know. And I guess if the elected officials would like to introduce themselves, then we can move to the rest of the members.
Sure, happy to. Senator Malcolm Augustine. I apologize for not attending the last meeting. I did get an opportunity to watch it on YouTube, so thank you for making that available. I really appreciate it. Thank you.
Hi, everybody. Delegate Robin Lewis. I serve in the House on the Health and Government Ops Committee. For those of you I haven't met, good to be with you again.
All right. Any other elected officials present? I'm not seeing any. Otherwise, I kind of just, let the other members introduce themselves. Ms. Seacott, you're coming up first on my list here as it's presented to me, so I'll let you start it off.
Thanks, Andrew. Ann Seacott with Public Policy Partners. I'm representing the National Council on Alcoholism and Drug Dependence, the Maryland chapter.
And then I see we have some, let's see who else, all right, Dan Martin.
Hi, everybody. Dan Martin, representing Mental Health Association of Maryland. Thank you.
Neil Karhanis.
Hello, Neil Karkanis here on behalf of the League of Life and Health Insurers.
Allison Taylor.
Hi, Allison Taylor here on behalf of Kaiser Permanente.
Morgan Mills.
Hi, Morgan Mills on behalf of NAMI.
Patricia O'Connor.
Hi, Pat O'Connor, Deputy Director of the Health Education Advocacy Unit.
And Kimberly Camerata.
Hi, everyone. Kim Camerata, Director of the Health Education Advocacy Unit.
Great. I think that was everybody. If I missed anybody, I guess speak now or forever hold your peace.
Hi, it's Debbie Rivkin with Care First.
Sorry about that.
I don't know if you see me or not, but I see myself, so I'm assuming you see me.
Oh, sorry about that.
And Ellen Weber from Legal Action Center on we convene the Maryland Parity Coalition.
Great. All right. So,
Andrew, did you want I'm an Assistant Attorney General with the Maryland Insurance Administration. Okay, Betty Diener. I guess Van is on the call too, right? Okay.
Yes. Okay. So for this meeting, I thought,
one more elected is here.
Sorry.
That's you, Delegate Cullison.
Oh, okay. Good afternoon, everyone. Delegate Cullison, Montgomery County, District 19.
Great, thank you. Yeah, so for this meeting, I just sort of thought it'd be good to kind of pick up where we left off, more or less, and kind of continue the conversation of the structure of the CHAP program as it would be in Maryland. Last week we had a great presentation from New York and got a really good overview of how they operate, and there's a lot of things we liked out of that, but I sort of wanted to start this particular discussion of the program description with the overarching structure, but where it should be housed. And I think from there we can kind of go to different aspects of the structure in terms of the program description, funding sources, but starting there I thought would be a good part to kind of get the conversation moving. So I guess, kind of open it up to some suggestions that, those have on which agency a program such as this could or should reside.
I see Delegate Collison has her hand up.
Floor is yours, Delegate Collison.
Thank you. I'm not shy. So, so one of the things that I have been interested in through all of these discussions that we had is to make sure that that when we create this very important program, that we make use of current resources and knowledge and experience that we already have, and make sure that that the entity that is running the program, in charge of the program, has the capacity to make the connections between the different entities and stakeholders in this group. So you've got all the community resources, you've got the state resources, you've got Medicaid, you've got the Attorney General's office, you've got MDH, you've got MIA, you've got all of these agencies and resources and programs that need, in order to respond to the issues that have been raised by this bill, have to be coordinated. And for me, I think, there's a place, and I'm gonna look to the commissioner and say, I think there's a place in MIA where we can start, and that by creating whether we want to call it an ombudsman or a navigator, but that there is a program inside MIA right now that could be bolstered up in order to provide the services that we're looking for here. And it would also allow for coordination between MDH, the Maryland Health Benefit Exchange, and the Attorney General's office, because it already has a lot of those connections in place. And there's even some connections with Medicaid. So I don't know what it looks like exactly, but for me, I think that I'm going to just throw that out, that I think, barring any arrows or tomatoes from the MIA folks, I'm just going to put it out there and suggest that that might be a place we can start.
It's Anne. I'm curious as to how that happens. I'm going to assume it only could happen if there was a statutory change to the MIA's, ability, especially with regard to dealing with issues around Medicaid. And then sort of my subsequent question to that, I am not advocating for anything in specific on this question isn't meant to do that. Does that mean then we could add that ability to, for example, the Attorney General's office, or to another office, another coordinating body if we decided to? And therefore, is this necessarily limited to, if that expansion were to happen of an existing service, would that be limited to MIA?
Dan, you have your hand up?
I do, yes. To address Delegate Collison's issue, I think, if the General Assembly decides to give something like that to the MIA, through a statutory revision, it's something that obviously the MIA would do. I think one issue that would need to be addressed is the funding source, because the activities here are different, than the regulation of insurance. The funding source, similar to this, would need to be separate and distinct from the funding source for the regulatory activities of the MIA. To the extent that an ombudsman would be housed within the MIA, I would think you would want to have someone who would be, I know you'd call it a director or ombudsman who I guess is hired by the MIA or hired by the commissioner. But then it's an independent unit of the MIA. I'm just kind of thinking off the top of my head, but an independent unit of the MIA that would handle these responsibilities, similar to what Stephanie Campbell is doing in New York, and would be responsible for hiring staff to do it, and also contracting with the outside sources, and including MOUs with such entities as the HEAU for their services in connection with this, I would think.
Alan, you have your hand raised?
Yeah. Yes, I do. Thank you. So obviously the bill proposes something entirely different. It doesn't put it in any particular state agency because we think that there are potential conflicts to having them in state agencies and the lack of expertise to do this. It also prevents you from having the kind of on-the-ground assistance that you have in the hub and spoke model that we've identified and that was prominent in the New York CHAP model. A major difference that exists in between CHAP and what would be proposed in the MIA variation, or particularly any other state agency variation, is that the CHAP program does not, the Ms. Campbell in the Department of Health does not deal with any insurance matters, neither the private insurance matters or the public insurance matters. Those are dealt with exclusively by the freestanding independent organization that is the Consumer Service Society and all of the organizations that it has connected with and that it contracts with. And the reason it does that is because there's an inherent conflict of interest. If this entity is within any of the state agencies that are responsible for adjudicating insurance claims, whether those are private claims or public claims, that is an inherent conflict of interest. And I can't even imagine, I mean, I fully appreciate Van's recommendation that this would have to be a completely independent entity, but it is still very hard to envision how any consumer would view it as an independent entity where they are coming to this ombuds program or this program, whatever one would call it, with a complaint against a carrier, and have the very entity that adjudicates that complaint being the entity that is in fact supposed to be helping it. I mean, the two are totally inconsistent. It's a complete conflict of interest. And so I just think that that kind of a structure is inherently one that is a real problem for those purposes, but it's also one that the consumer simply isn't going to feel comfortable coming to and using. So I still strongly oppose that being connected with any state agency. There are many state models out there that are in no way housed in a state agency. We've identified Vermont, we've identified the California program, and even the Connecticut program that is a state agency is a fully separate and independent agency. It's not within the state insurance department, and it's not within their Department of Health. And so again, I would strongly oppose that kind of formulation as one that really is going to help consumers.
Thank you, Alan. I have two hands up. Van, I think yours popped up first.
I don't want to get too technical about the issues such as conflict of interest. I will note that that's an issue that has been raised and litigated within the MIA previously. That frankly, the commissioner sits both as the regulatory body and as the adjudicatory body, and so the courts have said that is not a conflict, that is allowed. And you know, and similarly here, you know, if you have an independent unit, they would have to be walled off, I would think, from the attorneys of my unit with regard to their activities relating to the, you know, working with regard to complaints. But you know, Ellen referenced CSS, and it's true that the CHAP program in New York utilizes that, but that's not any different than if the independent unit here worked with HEAU unit. I mean, that's really a very similar situation here. The CSS program is a statutorily created program within New York. So, you know, I think that is something that could be worked through.
Anne, I believe you're next.
Thanks. I guess, you know, I want to ask a question then on the flip side, based on you know, the revisiting of what the bill had provided for something totally independent. When we talk about Delegate Collison, when you mentioned that the you know, MIA would already be, you know, have relationships with some of the various other agencies. I guess just as we would have to change some of the authority and the funding and things like that if it was in the MIA, or I suppose any other agency. The flip side of that would be if we did it as proposed in the bill, and going through something like the University of Maryland system, you know, could not these MOUs with the other agencies be established? You know, could we not give them the permission for whatever, you know, working arrangements that they would need to have in order for them to be able to conduct any of the services that we were proposing?
I'm not sure if there's a specific answer, or if anybody has a specific answer to Anne's question. But Delegate Collison, you have your hand up.
I don't know that I have a specific answer to Anne's question. I think that those same types of MOUs, though, could exist between the entity that sits inside MIA and the resources, the network of resources that are available through, you know, in our localities across the state. You know, I guess I'm not understanding how this would prevent the notion of the hub and spoke model. If there was an entity similar to what exists in New York, it's sitting in New York, it's sitting in the Department of Health, actually under another agent. So it's, you know, under two levels, and it hires a third party to be that hub and spoke model, and can try it. At least that's how I understood it. I could be wrong, but I think we would have the potential within MIA to have to set up that kind of network, to have the MOUs with providers and networks of providers and navigators that would allow us to be successful. I think, you know, for me, the issue is we have these resources already available. Developing an entirely new infrastructure only delays what we can potentially do, because and to talk about the funding, it was always envisioned that there would need to be additional funding, and it's an additional kind of role for the MIA. But right now, I direct constituents to the MIA all the time about all kinds of insurance. And it's one of the most responsive agencies. My constituents tell me it's one of the most responsive agencies they ever contact. So, and they get the issues resolved. So it's not like they don't have the experience and knowledge of how to deal with complaint issues. And I think, you know, we just have to envision how we set it up in a way that, number one, there's an information a marketing program included that says to consumers, this is where you can call. When you are having issues around finding mental health services, when you are having issues around dealing with getting insurance carriers paid, to pay for mental health and substance disorder, substance use disorders, here's the number you can call. Here are the people who are going to take you to the place and can do that warm handoff that I think we've been looking for. Doesn't have to be, I'm going to give you a phone number and you're going to call them and they're going to give you a list of providers that you now have to call and find out the one that works. But what's, someone who's going to be there to say, what's your insurance? What have you done so far? And here's how we can help you follow up. So I believe that we have a resource already in place that we can add the funding to, that's being requested in the bill, and that will allow us to make those kinds of connections and to have that program be successful and actually do all of the things that we are looking for in the bill, in the original bill. Oh, I'll turn it over now. Thanks, Van, or Craig.
Thank you, Delegate Carlson. Two more hands. Ellen, I believe yours popped up first.
I defer
Let
to
me jump
Senator
in.
Augustine.
Larry, let me
and then
jump
I'll
in.
come
Sure.
After you.
Please. Thank you. First of all, thanks everyone for this conversation, and thank you to MIA for this discussion. There's a few things, and I don't think it's all to be done today. But one of the things that I would ask for offline is how MIA would address each of the specific consumer assistance services that are listed in the bill, all of them, and those that they would not be able to do just based on their framework, and who they are. So that I would ask for. I am grateful though to be able to hear this and to have this discussion, but I think that that's something that will take a little bit more time to just sort of like better understand how they would be able to do those things. I also just want to circle back though to this. I am not satisfied with the resources that we do have right now for folks. The reason why we're here and having this discussion is because Marylanders are having a hard time accessing these services. And there is not a centralized location that's independent that people feel good and comfortable about going to. And I have not yet heard how that would actually be, how this separated entity, which has these different things that they're trying to do, will be able to do that. So I would also ask that the MIA could try to work on answering how they would be able to and Van started the conversation, how they would envision being able to have those dueling roles and how that would be presented as well to the consumer, how the consumer would be able to see that. So I would ask for those things to occur offline, if possible. The other thing that I'm sitting here and I've been listening to these discussions. We're talking all about the structure. We have yet to talk about the areas of concern that people actually expressed during the actual conversation around this bill. We just haven't done that. And so I'm at a point now where I'm just going to assume, I'm going to start to assume based on that the bill and the issues that were there that we work to address, people just don't have a problem with that. Okay, so we can look at this new conceptualization, which again, I want to see how it can all fit together. But because we haven't really gotten into the specifics of those things, I'm just going to assume that those things are all okay. Because that's actually what we were supposed to do with this work group, was to try to go through those areas of concern inside of the structure of this bill, not to talk about some other bill or some other thing altogether. So I'm just going to, either that or I'm going to have to take written, folks can provide their things in writing or something, because that just hasn't, we haven't been able to get to that. And I really obviously had hoped that would be something that we would be able to get to. The last thing that I want to say is this idea about like not having a separate entity and things like that. I'm going to do some more for my own homework on that. And part of the reason that I think about that is because I sit on the board of the Maryland Patient Safety Center, which was set up by the state to do just that, protect the safety of Marylanders with regard to their interaction with the healthcare. And it is independent. And we thankfully have provided some funding. The Maryland Healthcare Commission provides grant work. It's separate. It's an individual entity that has that charge. And so I want to do some more homework on things like that do have that independence, that can do the kinds of things that we envision in this, what we envision to try to address this gap that we have right now in what people are receiving and how they and what our outcomes are. And so please, if you all could do that for me, I would appreciate that, MIA, because like I said, I understand this idea and everything else, but I really would want to know more about that. Thank you.
Thank you, Senator Augustine. Ellen, you raise your hand.
Yeah, I mean, I think that, the only other thing I really do want to emphasize here again is, I keep coming back to this. There are no consumers who are sitting on this work group. And it is the consumer voice and their needs that are at the focus of this project and this effort, because it's their needs that haven't been met over many, many years by the very organizations. And I'm saying this with all due respect. I really am. I am not here to critique anybody's work and what they've done so far. But the entities, the state entities that are on the call and in this work group have not met those needs over many years, even though this state has had an escalating substance use crisis and a mental health crisis for many, 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 many years. This isn't something new. And so the goal here is to be able to be responsive to consumers. And so absent their voice in this conversation and in what they would see as useful to them, I think we're missing one of the most important components. A group of consumers before this meeting had a conversation with Delegate Cullison and tried to identify some of the very essential things that are most useful for them in getting the care and getting the assistance that they need. None of them identified that as being available through a state agency. They identified it as being through other resources. And until this work group can take those views into consideration, I think anything that comes out of this work group is incomplete at best.
Delegate Collison.
Thank you, Craig. And I'm glad Ellen mentioned that I did meet with a number of consumers earlier today. And I have a different perspective, Ellen, on that conversation. And I thought I expressed it in terms of the issues and gaps that the consumers, and they told very personal stories and really are strong and compelling in their advocacy around the need for specifically around navigation of services. That is where, finding the services when they need them and getting them as quickly as possible. And making sure that they have the right services and making sure that they are dealing with their insurance company in the way that facilitates the services that they're either themselves or their loved ones need. And with the exception of some issues around provider reimbursements, which clinics can accept private insurance versus just Medicaid, some of the issues that are specific to locality. I felt like everything that we're talking about can be addressed by having an ombudsman / navigator identifying that entity, within MIA, using the resources of MIA. And again, when insurance is an issue, they are our experts. So I actually felt like I heard their stories, and I think, and I believe I even said this, I think that we can deal with all of these issues. Right now, there isn't, you're right, Alan, right now, there isn't a place where people necessarily know that they can call and say, my insurance company just sent me a list of 54 providers and I've called all of them and they can't, none of them are available, or they're not providing the service I need. What can I do? So there isn't that place right now, or they don't feel like there's that place right now. Maybe it is, maybe it does exist, but I don't know it. But I think what we're talking about, where I'm thinking where it sits, we can actually do that. And I don't see any reason why we can't. I mean, I've heard, a little bit about distrust of government. And if it's because the government agency isn't doing what it's supposed to do, then we need to deal with that as a legislature. And in terms of where consumers know who to call, what's going to make them call an independent agency any sooner than they're going to call the entity within MIA? How are they going to know where to call? That's the education program. And we're all agreed that there absolutely needs to be an education program around this. So I guess, I think what we heard from consumers is there's a significant need around efficient placement into appropriate services and dealing with all of the nuances that go on. And some of the concerns that I heard specifically could happen at the local level, as long as there are these coordinating networks, which, again, this entity that I'm discussing and that I'm envisioning could create those coordinating efforts or networks of folks. So while there's nobody directly on this, we heard from them in the hearings. I know that Senator Augustine has met with people. I've met with folks. We are trying to deal with them. We're not ignoring these issues. And I don't want us to go back to saying, we don't know what the problem is. Because I think now I feel pretty certain that I do know what the problem is, or I have a good sense of what the problem is. And now there's more than one option to address it. And now I'll stop.
Thank you, Delegate. Van, you had your hand up earlier. I don't know if you needed to follow up at all or no. Okay. Ellen.
Yeah, just a few quick points. I mean, one of the reasons that individuals with substance use disorders don't go to state agencies, as we all know, is because it's a criminal activity to engage in drug use. That's a very simple, basic fact. And so one has to be aware that that is going to always influence a person's decision as to where they're going to seek services. And to the extent that it is in a state agency, that undermines it even more. I think Stephanie Campbell alluded to that, in addition to sort of the significant stigma that exists. And so that's a real problem. I think there's no question, Delegate Cullison, that marketing and advertisement is going to have to be a significant part of whatever this effort is, regardless of where it is. The likelihood of somebody going to a local entity versus a centralized state agency is because it is made up of individuals from the community. As you know, and as you heard in the conversation earlier this morning, a key feature of the way CHAP has been structured is that it will involve individuals with lived experience. And so there were people who shared that very basic experience, that need as well. And so there are a number of features that are baked into that CHAP model that will address, the various issues. And the very last thing to mention, there's no question that finding providers, navigating insurance was a key issue, but there are also, as you heard, people identifying the need to have assistance to challenge denials. And that's a significant issue. And again, I am, just as Senator Augustine said, very much interested in seeing how MIA thinks that they can wall off these various activities. But part of the significant role of CHAP is to be able to provide direct legal guidance, direct legal assistance, not advising people, not drafting a complaint, but letting them file it. It is from soup to nuts, assisting and supporting that individual. And I just cannot again begin to envision how one could do that if you're situated in the MIA. I just don't envision, I don't see how that can happen. And so that is, and even, I guess, even if you identify how it could theoretically happen, how then would that be carried out? How would that be a situation in which an individual would feel, the consumer would feel comfortable coming to that entity and truly believing that they have that they have their interest solely at heart, and that they are actually that person's representative. So those are important features that I think have to be dealt with in whatever model you're getting. It's a soup to nuts need.
Dan, again, I think I saw your hand up for a moment. I didn't know if you still needed.
Well, I think it may be lost on the fact that the MIA does these types of services today in some regard. We do have a consumer education advocacy unit, Joy's unit. They do their work very well. In addition to that, complaints are reviewed. Those are different people who review the complaints, and it is something that you can wall off, and so it's not just theoretical; it's actual. But we can have that discussion offline if you want.
Yeah, I want to have that discussion offline, Van, but that in essence is my concern, okay? Because like you said, you're already doing it. And so if you're already doing it, and we're already talking about there being a gap right now, this is central to a part at least of my concern, because we're talking about trying to have something that is outside of that. We've had these conversations before about the inaccessibility of MIA perhaps to individuals. But even with the existing resources and the existing things that you're already able to do. But like I said, I'm looking forward to seeing how you are able to deal with that and responding to what this entity that's in the proposed legislation sets out to do. But I just have to say, like, that reality is why this was brought forward, was because it felt that there was a gap, even with the existing authority that existed within MIA, within the health unit, that there was this problem, or problem's not the right word, a gap, let's say. Not problem, but that the gap.
And if I can just respond real quickly, and I know, Joy, you have your hand up. Not suggesting that we deal with Medicaid or self-funded plans right now. That would require the legislative change, of course. So, there are gaps, of course, and this is aimed at something different in some respects. But those are things that can be handled through the legislative fix. And I'll turn it over to Joy.
So, Senator, just briefly, right now, and I'm hoping that a lot of you are aware that on the property and casualty side, we have something called a rapid response program, which is different than our formal property and casualty complaint process. We basically have people that assist people one-on-one quickly with their property and casualty claims. We don't have the authority right now to do that same type of one-on-one helping people with the services. So if something were statutorily changed where that ability were to be given to the MIA, I would think that it would be structured similar to our rapid response, but also very similar to what's occurring in New York, because I think we all agree there's a gap there, but it's just because right now, based on the status of the law, the MIA doesn't have the ability to have that similar type of one-on-one, for lack of a better word, social worker, navigator services. So, I mean, but that's only because we don't have the authority right now. But given the authority, that is something that the MIA can do. And we do it on the property and casualty side right now.
That's good. I'll be looking forward to seeing how what would be needed, what would be required, and all those kinds of things. But I also just have to, we talk about New York, y'all brought New York back up, but CSS is not, it's, as far as I know, CSS, who provides these things, right? They're not a government entity. I mean, CSS is not. I mean, that's my understanding. You guys can correct me if I'm wrong, but those who are actually in there and doing it, they are that community organization that's doing those kinds of things. And it's a partnership, yeah, but they are not. I mean, that's my understanding. Y'all can correct me if I'm wrong about that, but there is, that they are not like a part of the government.
Not sure if anybody has any specific reply to the CSS aspect, but.
Well, I think the answer is that they are independent. I mean, that they are a separate entity. They're not a government agency. They do receive funding to be able to support this work, but they are not. I mean, they're outside of it.
They are a statutorily created entity that was created, I think, in 1843, which partly explains why the structure is what it is. And so it's true that they are not housed within government, but they are also, and this is interesting, they are also similar to HEAU, the Affordable Care Act entity, resource for individuals under the ACA, which is what the HEAU unit is here in Maryland.
That's right, I know that. But then, as I mentioned to you before, there's a similar situation for that for the Maryland Patient Safety Center, which is just separate. This is just from my own things that I've done, which also has designation, federal designation, but it is also a entirely separate, entity, nonprofit entity that provides services for the people of the state of Maryland, as does CSS for the people of the state of New York. That's all that I'm trying to say.
Well, so, as far as, does anybody have any more comments on the, general debate on the structure? I know, Senator Augustine's been very clear on what he would like to see. Anne, raise your hand.
I guess it really is just an issue of there's a significant amount we would have to change if we place this within the MIA. There's a significant amount we'd have to change if we put it with the AG. So I guess I'm not clear what benefit or benefits might exist by putting it with one of those agencies that right now simply cannot do everything that's proposed, as opposed to doing it as proposed in the legislation and having it go through University of Maryland and and then from there getting the spoke entities set up.
And can I just respond to that? I mean, I hear what you're saying, but I don't want to presuppose what the MIA, what they are going to go back and take a look at this and give, listen, I'm open to it. I want to see how they feel like they're going to be able to address the concerns. We're not going to be able to answer that right now on this call, though. I mean, I understand I've heard very loud and clear from both you and from Ellen some high level concerns. I'm sure the MIA has heard that. All stakeholders here have heard that. And, you know, offline of this, you know, I definitely hope that they will take that into consideration as they are coming back to us with how they would envision what the changes would need to be, where those gaps would be. And I really would be grateful for them to do that. I mean, I think that we want to see that, not to presuppose what will or won't be. I think that we have shared concerns. I think we always got to get back to sort of why we're even here and talking about this. And so that I just, you know, I asked them to do that. You know, we talk about kind of like, I don't mean to jump the gun. I know we want to hear from the public. I definitely want to do that. But I feel like, you know, that's where this is right now. So if they want to come back and share that with us, that sounds like a plan. That sounds like something that we would want to see, we want to talk about. I'm still going to say that we haven't, you know, unfortunately addressed if there are any concerns with the bill itself within a separate entity, because I think we will be able to have a comparison. Let's compare the two potential ways to address the concern. I'm good with that. Let's do that. Okay. And so I just hope that we can do that. We can move forward in that way. And can MIA do that for us?
We will certainly, as I think we've indicated, we will certainly try to go back and answer the questions that you have asked, Senator Augustine, and try to put up a proposal along those lines.
Okay. I mean, I would be really grateful
Or
for that.
not a proposal, just a way to answer those questions.
Well, I would hopefully there would be a proposal, man. I mean, look, that's what this is. We're trying to address a concern, an area. This is an alternative. A discussion right now is about an alternative based on concerns. I mean, I hope it would rise to the level of a proposal.
Understood. Thank you.
Delegate Collison.
Thank you, Andrew. I'm apologizing for calling you Craig earlier. So,
No worries.
sorry. So I just quickly wanted to respond to Ann, and I appreciate what the senator's asking for, and I look forward to that. I think that's really important. But part of my motivation for suggesting it be within the agency is because I honestly believe that while they may not link as often as they should right now, the Attorney General's office, MIA, MDH, especially Medicaid, all, you know, have sort of cursory relationships now. An external entity, which if the design is as I'm envisioning it, and I will push, you know, MIA to envision it in a way that strengthens those connections. An independent agency is going to, or independent entity is going to have to build those connections with those state agencies in order to move things forward. So I think we start with what we have and build it as opposed to building something new. I mean, I think, and part of what we have is existing knowledge, existing expertise, existing relationships that can help us to move forward faster.
Ms. Ripken.
Hi. I just wanted to just react to a couple things that I heard. To me, just from non-duplication of services, it makes most sense to me to have this type of program housed at the Insurance Administration for a couple of reasons. First of all, I still believe, and I'm going to defer to Van on this one because I'm not supposed to be a lawyer anymore and at my company, but I think there still are a lot of HIPAA and confidentiality issues if it's housed outside of the MIA, but none of those issues become a problem if it is at the MIA. Secondly, Joy, thank you for raising the program. I'm quickly reading it, and I think it has you're right. It does exactly very similar to what we are all looking for on the health side. So therefore, again, there's no duplication of effort because there's already an entity that's been created at the MIA that is doing things. And I'm reading from it, developing an information and assistance system to help provide information about and help consumers with their coverage, claim procedures, and services. So there's already an infrastructure in place. We can add to it. And today, individuals file complaints by hand, over the phone, with the insurance administration when they have a complaint with their insurer in terms of services. So there's already that built-in infrastructure that just has to be built out as opposed to starting from scratch. And I think so it makes a lot of sense to from those different elements I just mentioned to build out whatever we need to do at the MIA. Thanks.
Ellen?
Thank you. Just one question in terms of the response to questions I think that Senator Augustine has asked of the MIA. Is part of your as part of that, if you again, as you know, the model that has been established, one of the reasons that it's an independent model is because it's designed to deal with people who have all different types of insurance, including individuals who may have more than one type of insurance. And so that will include Medicare. It includes ERISA plans. It includes veterans benefits. It includes state employee benefits as well as federal employee benefits. So I guess that's the other question that I have. How would the MIA plan, how would the MIA's model envision doing all of those? Because as Delegate Cullison said, MIA certainly knows insurance, but they know state regulated insurance. And that's what their mission is. Their mission is not to deal with ERISA plans or any of the others. And so if you wouldn't, if that can be included, if you intend to include that, that would be greatly appreciated.
Thank you, Alan. I just wanted to kind of open it up for kind of moving into the public comment section. Just wanted to kind of give everybody an opportunity to make any additional comments before heading in to the public comment. All right. And, sort of seeing none, I would ask those members that are viewing the public to put their questions into the chat so that they could be addressed in order as received. Not seeing any come in. Give it a little bit of time, but as that may or may not come in, I guess we sort of, even though we've already touched on basically next steps, maybe a little more detailed about how we want to finish the work group out here. So obviously, legislative sessions, fast approaching, and got more or less 2 more months until then. So as far as at the next meeting, Senator Augustine, you made it very clear what you would like to see. So, I guess are we all sort of in agreement that, MIA will, come up with, a draft proposal for us to review at then that next meeting, and then, maybe one more meeting after that. So I'm envisioning a meeting in November and then a final meeting in December to come up with a final solution, more or less here. Again, I'm not seeing anybody say no. So I guess that's what we'll go with. And, I'll coordinate and we'll get dates sent out as soon as we possibly can, and, try to be mindful of, understanding that the next couple of months and holidays can be challenging for folks, but we'll try to work around that as best we can. And again, I'm not seeing any public comment coming in. So, and for those that are viewing from the public, if you'd like to, forward other questions via email, that's fine as well. But I guess I'll leave it up to, final round robin here. If anybody else would like to have any other thoughts, comments, or suggestions before we have our next meeting? Okay. Oh,
just say,
sorry.
I'll say thank you to everybody for continuing to stick with us on addressing this very, very important matter for the people of the state of Maryland. I'm grateful for the dedication and the time that's being put into this. I don't take it lightly. I do appreciate it and look forward to us continuing it. So thank you, everybody. Thank you.
Thank you, Senator. All right, well, with that, I guess we can close it out. Thank you, everybody, and we will all be in contact soon.